All right, so for my project, I chose to talk about COVID-19 and the pandemic that we're currently facing. So just a little bit of information to get us started. Beginning on January 30th, 2020, coronavirus was declared a public health concern at the international level by the World Health Organization. From here, on March 11th, 2020, novel coronavirus was then declared a pandemic. And then 2 days later, the US declared a national state of emergency. Since then, coronavirus has changed the world we live in drastically. Before moving on to how the US has responded to the disaster, we should probably understand exactly what coronavirus is and where it comes from. So, coronavirus is a respiratory illness. Some common symptoms include fever, dry cough, mild breathing difficulties, GI issues, diarrhea, and just an overall general fatigue and general body aches. Coronavirus can be transmitted through droplets, so coughing or sneezing, and then touching contaminated objects or coughing on someone else. All of those ways coronavirus can spread. And coronavirus is actually a generic name, so it includes a bunch of different strains, and then COVID-19 is the specific strain that we are looking at today in the presentation, and the specific strain of coronavirus that has caused this global pandemic to occur. So where did it come from? The first case of coronavirus occurred in China, and the outbreak was officially reported by China on December 31st. From here, the virus really spread really quickly. About 1 week is just how long it took for the virus to spread throughout all of China, and then in a single month, we saw coronavirus in dozens of countries. So on the right here, we have a couple of graphs here. So the first one shows the 10 worst affected countries by coronavirus. So as you can see, the US is at the top of that list, unfortunately, with a little over 2 million cases and around 100,000 deaths. And then looking at the bottom graph, it's just a little visual on how the coronavirus pandemic progressed in the United States. So it just takes you through all the different months. You can see that New York State was the most largely affected and was actually the epidemic of the epicenter, of the pandemic for a while in New York City. So just a little bit of glimpse into the public health response. So these are all the professional organizations that have been dealing with the response a little. So starting with the World Health Organization. The World Health Organization is really concerned with tracking the virus and with ordering of different medical supplies and setting up different funds. Another big thing the World Health Organization is including in their response is providing guidance to the public, really telling them how they should be handling the pandemic. Moving on to the FDA. The FDA is all about expanding resources, including accurate and timely tests, which we lacked at the beginning of the pandemic in the United States, and adequate number of medical equipment, such as ventilators, as well as continued supply of these safe resources. So we don't want unsafe companies making medical devices that don't work as well as these certified medical companies. And then lastly, the CDC is all about allocating funds in certain areas to really combat this COVID virus. So some of these areas that they're allocating funds include infection control, different emergency funds, vaccine research, and epidemiological studies. All right, so from the media standpoint, I picked out 3 articles that kind of explain how the media is responding to the coronavirus pandemic. First, we see an article that was about New York State specifically, but I liked it because it did show exactly kind of what each state is doing for their response. So in this article, they talked about all non-essential businesses closing and 100% of non-essential workers staying at home or working from home, which you see in a lot of states in the US. Obviously, the public health response differs between states. Each state is in charge of their own regulations, but this is a very common one, so I use that. Next, ABC News put out an article about how social media undermined the COVID-19 response. And I thought this was a very relevant article because really this article stated the distrust amongst the American people with the government. And so if people don't trust the government, they're not going to follow their regulations, and it's just really just going to hurt the response as a whole. And in this article, they talked about how doctors, public health officials, everybody's learning about this virus as we're going. So as a result, there is a little bit of inaccurate information, and social media is really just exacerbating this information, the spread of this information, leading to a lot of misconceptions, which we'll go into a little bit more later. And then finally, Article 3 is about how technology is playing such a vital role in this public health response. So we're using technology for population surveillance, case identification, contact tracing, and even current evaluations of the regulations we've already put into place. So this technology is really important right now to our response for COVID. All right, let's get into those response a little bit more. So before I go into this, I just want to say that as far as effectiveness of the public health response for COVID, it's really hard to say if it's been effective or not yet, since we don't have enough research and we're kind of directly in this pandemic right now. But as far as these responses, the stopping of the spread go, I think they've been somewhat effective. But I also think that moving forward, we can change some things, which we'll talk about later. But for stopping the spread, they implemented social distancing, restricted large gatherings, they had mandatory quarantine for infected individuals, and this really includes if a family member of yours is infected as well. You have to mandatory quarantine. They implemented face masks in several states, just like New York State. They closed a lot of non-essential businesses such as restaurants, gym, and malls across the country, and a lot of states closed universities, primary schools, and daycares as well. As well as this, you see in some states regulations on how many people can work in offices at a time, as well as encouragement of working from home when possible. And then as a country as a whole, we've had travel bans and vacation cancellations, so restricting travel outside of the U.S., closing the borders between the U.S. and Canada, and canceling these cruises and vacations that people had booked. And finally, we see a lot of restrictions on who can visit in the hospital, as well as nursing homes. A lot of nursing homes have actually shut their doors to any outside visitors and require that their employees quarantine when not working. So moving on to the public response on the side of helping the people. So on March 27th, the U.S. signed into government the CARES Act. So the CARES Act is all about different relief and aid for people that have been affected negatively by coronavirus. And I will say that I do think this has been very effective for the public health response. It seemed to have drastically decreased the number of people that have faced financial burden and just struggles. So starting with let's just look at some of the stuff that the CARES Act does. So as many people know, there were stimulus checks sent out of $1,200 for eligible individuals and $2,400 checks for eligible families. So for this went off of a income. So if your income, I think, was less than $100,000, then you were eligible for the $1,200. And if your family income was less than $200,000, you were eligible for the $2,400. Moving on, they also extended unemployment benefits and added an additional $600 a week paid by the federal government. So each state has its own regulations on how long someone is eligible to receive unemployment, and the government extended that by 13 weeks for every state. They also reduced and or postponed mortgage payments, and said that, and they protected people from getting evicted till mid-May. As well as this, the federal student loan payments that everyone had to make were suspended, as well as interest. And paid time off was included in this act for those who either contract COVID or have family members that do. So that way it really provides an incentive for people to stay home if they think they have COVID, or their family members do. So this is a huge part of stopping the spread as well. And then lastly, we saw tax filing extensions for those who needed it. So looking at a few barriers, first, we've seen a health literacy deficiency in the US and actually globally. So this is really important. Having health literacy skills is essential in the prevention of communicable diseases. The ability to find information as well as understand it is important. Like, we need to be able to do these things in order to combat a disease as intense as COVID. Next, we've seen just a generalized disobedience from certain individuals. So ignoring of regulations and laws, a lot of people still refuse to wear a mask, or a lot of people refuse to social distance and aren't really following these government regulations. And like I said earlier, this goes back to trust, and a lot of people don't trust the government right now, so they're not going to follow these laws. And then lastly, I just thought I would bring it up because it is another thing that is preventing this public health response from being at its most effective level. But a lot of people think that COVID just is not real, that it's a political scam, and therefore they're not going to follow these regulations again. All right, moving on to barriers at the community level. First, and I will say this seems to be the biggest barrier that we have faced as a country, and that is we have a huge lack of resources. And this includes money, like different funds, medical supplies. We're super deficient in the amount of ventilators we need as a country, and we just don't have enough medical professionals to keep up with this coronavirus. So we're seeing a lot of overrun hospitals, people picking who gets care and who doesn't. And it was just a little bit of chaos there for a little bit of time. And another big thing is we don't have, or we didn't have, an adequate number of tests in the United States. So our levels of cases were probably severely affected by this because not everyone who needed a test got a test. Next, at the community level, we see a lot of large gatherings occurring everywhere throughout the country, including large protests that are going on right now. And this just happens to be going on at the same time as the coronavirus, and it's really not helping the case numbers. Finally, like I said earlier, there's lots of contradicting information circulating out there, which really doesn't help in a response. All right, so moving on to some lessons we can learn from this experience. First and foremost, we need to learn that humans are not indestructible, and communities must be prepared for outbreaks like coronavirus, which we were extremely unprepared for in this situation. So we need to learn from that moving forward. Next, we need to take away from this measures to stop the spread of contagious communicable diseases such as coronavirus should not be delayed. I think the United States and a lot of countries delayed their initial actions, and it really showed in the case number. Next, communication between public officials, the health community, and civilians needs to be improved upon. Like I said, there's a lot of misconceptions out there, and this goes back to the actual communication that's occurring. Another thing we need to do is realize that some groups are more vulnerable to some things than others. This is a big takeaway. We see with coronavirus that the elderly are especially vulnerable, the immunocompromised, and even those that have previous respiratory diseases such as COPD, and just smokers in general are just all more vulnerable to this coronavirus. And we need to take this out of this as well, that some people are just going to be more vulnerable to certain things than others. And then we need to learn from this that vaccine development is crucial. This just shows us why herd immunity and getting these vaccines is so important. And then finally, just an overall thing that we need to do as a country is produce more healthcare workers. There's a huge deficiency in the amount of healthcare workers we have in the U.S. right now. We're really needing more nurses, especially. So we just got to keep these things in mind moving forward. And then just a little bit of self-reflection. To me, I just want to talk a little bit about what being a community health nurse is. And to me, being a community health nurse means focusing on the health and wellness of everyone in a population. So this includes the underprivileged, the poor, and these vulnerable groups that I just talked about. And a lot of the times, these groups face harsh health disparities, and I just don't think this is right. And which is why I'm extremely fascinated with community nursing. I think everyone should have equal access to resources, education, and care. And this really is the overall aim of community nursing. Moving into the nursing practice, this is something I wish to strongly focus on and promote in order to try and combat some of the health inequalities faced in our country. And that is the end, and this is the reference page. Thank you.